President Biden is set to deliver his first address since Republicans took control of the House of Representatives.
The COVID-19 pandemic and mental health, particularly among children, are expected to be some of the health topics that he will discuss tonight. To discuss more about Mr. Biden's upcoming address, let's bring in Republican Louisiana Senator Bill Cassidy. Senator Cassidy, good to be speaking with you again. We should mention that you also are one of those rare physicians in Congress. And obviously, given the one of the topics we expect President Biden to address tonight is the winding down of the COVID emergency status, I'm curious what you hope he will say about the pandemic.
Well, there's a certain amount of kind of mixed messages we've been getting. They want $10 billion more, I think, or maybe more, to continue to address the pandemic, even though they're ending the public health emergency. And they're going to continue to put a pause on student loan repayment, even after the public health emergency ends. But that was the rationale for the pause to begin with. So there's some policies being pursued in the name of the public health emergency, but the rationale seems to be gone. I find that incredibly curious and incredibly expensive for the U.S. taxpayer.
So as a physician, though, do you think that the crisis, the emergency is over, or do you think that it should continue? Because I understand what you're saying about mixed messages. Where do you fall on that line?
If you look at the death rate, bottom line, it's a lot less than it used to be. Hospitals are not overflowing. It has now become endemic, so to speak, and vaccination and natural immunity and a change in the virus to become less lethal has all kind of contributed to that. Do we need to be prepared for the future? Absolutely. And Congress is working on reauthorizations of bills that will help with that preparation. But what destroys trust in our efforts is if the rationale for things like a pause on loan repayment is a COVID epidemic, which the people can look around and say is not the same as it was 2 years ago. Well, then why should I believe them if they're going to continue to use it for a rationale, but only for the policies that they want, not for the policies that seem to be of general benefit? So yes, I want to see work, but I also want to see honesty with the American people.
And Senator, one of the things that is more difficult to measure is the status of people's mental health. Some describe what's happening across the country as a real crisis. The president expected to take aim specifically at social media and the mental health of young people who are, of course, online so frequently. What's your take on that topic? And what do you hope the president does to address what is a challenging time for so many people as far as their mental health?
Yeah, this can be an area of common ground. Since I was in the state legislature of Louisiana and throughout my congressional career, I've worked to help address the mental health needs of the American people. Everyone watching this has a family member or a friend who's been affected by serious mental illness. If we include addiction, oh my gosh, it grows that much more. We've got to care about this issue. So if the president comes forward with wise policies to help address this, I think you'll find strong bipartisan support.
Policies like what?
Yeah, so we've been working on a number of fronts. Chris Murphy, the senator from Connecticut, and I passed the Mental Health Bill of 2016. And in that, for example, we had something called RAISE grants, in which states would have extra dollars to provide wraparound services to a young person who had her first episode of serious mental illness. And there is a program started in Maine, which has been shown that if you do those wraparound services, that the person can be returned to wholeness so that her mental health breakdown becomes a distant memory, not a life-defining event. What we found, though, after implementing this law, is that Medicaid coverage was so poor for mental health services in many states that states were using these dollars for things that should be covered by Medicaid. If the president proposes ideas which would strengthen Medicaid's ability to take care of those with mental health issues and allow the RAISE grant to be used for its purpose, which is to help that young person with their first episode be returned to health, I think that would be that'd be an excellent policy initiative.
It's good to hear you talking about finding common ground. We have heard overwhelmingly from Americans that they'd like to see more of that happening in Washington. When you're discussing, though, common ground, one of the things that people are split about, at least within the House, is the response to the debt ceiling. Do you want the Republican-led House to raise the debt ceiling?
It has to be done responsibly in a sense that there is some concession as to how do we stop just kind of out of control spending. Let's go right now to the pause on student loans, which has long passed its rationale. That has cost the taxpayer, I think I have that around $170 billion. That in of itself has moved our debt ceiling forward when it would expire from like August into June. There's other programs similarly in the name of the public health emergency the administration has pursued, which has pulled the expiration of our debt limit forward. I applaud House Republicans. They are making this an issue. It should be an issue. The administration should not have the I don't know how to put it, but they should not be pursuing policies which tangibly are making our indebtedness worse and then just carte blanche give us more debt ceiling. There should be a concession that no, we are going to rein in some of these policies that have been out of control. You raise the debt ceiling, okay, and in the meantime, we will rein in the spending over here. To me, that seems like a really fair trade.
All right, Senator Bill Cassidy from Louisiana. Definitely a hot debate with lots of different takes on it. Appreciate yours. Thank you.
Thank you, Senator.